I'm Chuck Vickery. I'm the founder of Vickery Financial Services. Earlier this year, Deanne and I and all the advisors were talking about what can we do different this year than we normally do. And we thought it'd be nice to come up with a series of workshops about things that we talk to people about and things that are important to people in their financial lives as they prepare for retirement and they're in retirement. And we're sort of known as a retirement planning firm. And lately we have just had a tremendous amount of questions about Medicare. So this is our first webcast. We had no idea of the coronavirus and COVID and the restrictions and the pandemic. And we sort of got off track a little bit because of that. And then Betsy Harder's on with us tonight as a co-panelist. And Betsy has her marketing firm and she's been working with us and she sort of had the impetus to get everything going. So welcome, we're glad you're here. I hope you'll enjoy this. It's going to be about 45 minutes. And if you have any questions, down at the bottom of your screen, there's a Q&A. Now, I'm not real good on technology, so I'm not sure what we'll see there. But I know if you hit chat, if you have a question or a comment, you can put it in. This is a Zoom webinar, not a Zoom meeting. So y'all can see me, but I can't see you, and you can't see each other. But I hope you'll enjoy this. So I'm going to take a second and share my screen. We've got a presentation prepared. And the title of this is 30 Minutes on Medicare Basics. Should be 40 minutes. What baby boomers need to know about Medicare. What is it? When do you sign up for it? How do you sign up for it? And what does it cost? Those seem to be the questions that we're getting. So Medicare was started in the 60s. It's the National Health Insurance Program for people 65 and older. It's administered by the Centers for Medicare and Medicaid Services, CMS. There was a big article in Atlanta Journal yesterday about CMS and how they're requiring all the states to go through all their nursing homes. Georgia has 3,100 nursing homes, and do a survey and update them on what's happening. And you actually enroll through the Social Security Administration. Who's eligible? Well, if you're 65 and a United States citizen, you're eligible. Or if you're a legal resident and you've been here continuously for 5 years, you're eligible. Or if you're under 65 and you're on Social Security disability, after 2 years you become eligible. But for our purposes, this presentation is going to be based on people that are over 65 or 65 and older. And Medicare consists of 4 parts, and it's a little bit unusual because Part A and Part B, Part A is hospital insurance, Part B is medical insurance. So A takes care of the hospital, B takes care of the doctor and the diagnostic, various tests. Those are both what we call public or government-run programs. Now, the 9 worst words I can think of, and the scariest 9 words I can think of, are I'm from the government and I'm here to help. But I'm here to tell you, Medicare is a good thing. And while it's administered by the government, the care comes from independent physicians and hospitals across this country. So A and B are public. C and D are private. Now C is a Medicare Advantage plan that usually covers hospital doctors and drugs. And then Part D is standalone drugs prescription. And both of these are private. So every fall, once you're 65, Medicare sends out a booklet called Medicare and You. And in that booklet, it shows the 2 options you have. And basically, these are the only 2 options that you have with Medicare. And the first option is optional Medicare, or original Medicare. It's Part A, Part B, And then you add the standalone drug plan, Part D, and most people add a Medicare supplement policy called a Medigap policy. Option 2 is a Medicare Advantage plan. And a Medicare Advantage plan is you select an insurance company that you want to be with. Most of these have health maintenance organizations or preferred provider organizations. In other words, they have a group of doctors and a group of hospitals that they have contracted with and that they work with. And you have to go to one of those. So each month, for every participant, the government sends the insurance company you've selected money. And it's about $800 a month that they send to them. Now, and so if you have surgery and you have Medicare Advantage, the doctor and the hospital sends the bill to the insurance company and they pay what they've agreed to pay. If you have original Medicare and you have surgery, the hospital and the doctor send the bill directly to Medicare and they pay. And what they don't pay, they send the bill to your Medicare supplement or Medigap policy and they pay. So these are your two options. And when you turn 65 or whenever you're eligible for Medicare, in some cases it can be a little later, then you have to choose one of these two options. So we're going to sort of go through them and talk about them. I will tell you this. The original Medicare is about 70% of the people. And the Medicare Advantage is about 30%. And the Medicare Advantage percentage is growing because they're very aggressive in their marketing and trying to get people to sign up. If you have a typical group insurance policy, the insurance company makes about $830 a year off of you. If you have a Medicare Advantage policy, the typical insurance company makes about $1,616 a year off of you. So these companies are very aggressive at marketing the Medicare Advantage plans. So how do you enroll in Medicare? Well, there's only two ways to be covered by health insurance once you reach age 65 in this country. And one way is Medicare, and the other way is under your employer group plan if your employer has 20 or more employees and you're somebody that's at that company is still working. So we're going to call these big companies. So a big company is one with 20 or more employees. And the 20 came from a law passed in 1982 called TEFRA. It's a Tax Equalization Act. And Congress picked out the number 20. So if you're working with a company with 20 or more employees and you're still working, you can keep your health insurance with that company past age 65. Or if you're covered under your spouse's plan as a dependent and your spouse is still working, even though you're 65, you can stay under that plan. So that's the exception. Other than that, you pretty much have to sign up for either original Medicare or a Medicare Advantage plan. If you don't enroll, there are penalties. There's a thing called adverse selection. And most 65-year-olds are in pretty good health. And they may want to wait a few years before they sign up. So let's say you're 68, you've never signed up. But now we've got this COVID thing going on, and you thought it would be gone by now. At least I did. But Florida set a record for the most infections in 1 week. So you're thinking, maybe I'll go sign up. So it's been 3 years. Well, you'll get to pay a penalty of 30% for the rest of your life. And that can be pretty expensive. So they don't want this adverse selection. And during this period of time, you may not have been covered by insurance. So and you don't want that. I'd rather be double covered for a month than uncovered for 27 seconds. Just Murphy's Law comes into play here. And your private insurance options may be limited, and they are limited if you don't sign up appropriately and on time. So how do you enroll? Well, if you're already receiving Social Security when you turn 65, it's pretty much automatic. Medicare Parts A and B are automatic anyway. If you are still working for a big employer and you don't want to sign up for Part B because you have group insurance at work, you can decline Part B and come back and add that later. And the coverage starts on the first day of the month you turn age 65. Now, Part C and D are not automatic. These are the private parts. So the government part, the public part is automatic if you're already getting Social Security. The private part is not automatic. You have to choose a private insurer and you have to proactively enroll. And if you want Medicare coverage, it's Medigap coverage, it's not automatic. You have to choose a private insurer and proactively enroll. The good thing about this coverage is if it's done in a timely manner, within 6 months of turning 65 in the enrollment period, it's guaranteed issue. So there's no questions asked and there's no exclusions for any pre-existing conditions. If you are not receiving Social Security when you turn 65, then you sign up through the Social Security Administration during one of the enrollment periods. Now, there are 3 Medicare enrollment periods. The first one's called the initial enrollment period. And if you're not covered by a big group at age 65, that's when you enroll. There's a special enrollment period, number 2. If you are covered by a big group at age 65, you can delay your enrollment until you terminate your coverage. And then there's a general enrollment period. And that's for people that just forget that they're supposed to sign up, or they don't know that they're supposed to sign up for Medicare. So those are our 3. The initial enrollment period actually begins 3 months before you turn 65. So I know we have a person on here whose birthday is in October. So you can sign up today. July, August, September, October. You're in that 3 months before you turn 65. And you can go ahead and sign up for A, for B, for D, for the Medicare Advantage, whatever you want to do. And on October 1st, your coverage begins. If you delay the start, you can do it the month you turn 65, or you can wait till November, December, or January, and you're still good. There's no penalties there. But if you wait during this period, you will have a delayed start to your benefits and to your coverage. So we encourage people, go ahead and do it 2 to 3 months, get everything in order, figure out what you're going to do, and put that to bed so you're not scurrying around at the last minute to get this done. Now, who signs up for Part A, the hospital insurance? Almost everybody. Now, if you're still working, you might want to check with your benefits administrator if you're working with a big company. And you might be advised to enroll in Part A, number 1, because it's free, but number 2, because it supplements your hospital part of your big group policy. However, if you're working for a big employer who offers a high deductible health insurance plan paired with a health savings account, and you really like putting money in that health savings account, you may not want to sign up for Part A, because as soon as you sign up for Medicare A or B, the health savings account is frozen and you can no longer add additional contributions to that. So that's Part A. Who signs up for Part B? Basically, people who are not covered by a big group and who are not still working at that big group. So, or who are working at that big group. So if you're not working, you need to sign up for A and B. If you go back to work, if you've been laid off, if you get an opportunity from somebody 2 years down the road, you can always go back and opt out of Part B and get back in it later. So if you're not working, you should enroll in Part A and B. If you're self-employed, you should enroll in B. If you're employed with a company of less than 20 employees, you should enroll in Part B. Well, I've got group insurance. We've got a little firm. We've got 6 people. Why should I enroll? I'm covered. You should enroll because that company has to voluntarily agree to pay your benefits or pay any claims that you have. And I don't know a lot of health insurance companies that volunteer to pay claims they don't have to pay. And that's that TEFRA rule we talked about. If you're on COBRA, you should sign up for Part A and B. If you're receiving retiree health benefits, so what I mean by that is you work for a company that lets you take your insurance with you. You've now reached 65. You need to sign up because that will no longer pay as your primary payer. Or if you're employed by a company whose health plan is less comprehensive than Medicare, you should sign up. Who should sign up for Part D? Well, people that sign up for Parts A and B and that want prescription drug coverage. And whether you want it now or whether you want it in the future. And if you don't sign up when you're first eligible, there is a late enrollment penalty. And if you have what's called credible drug coverage, you can ask your employer, do we have credible coverage? Some companies offer drug plans, standalone drug plans. And if it's credible, you can postpone this and not have to pay the penalties. So for Part D, you have two options. Either find a private insurance company or a Medicare Advantage plan. There is a special enrollment, people, and this is for people that are working for big groups. When I say working, I mean currently working for big groups because they passed up maybe Part A, but definitely passed up Part B. The reason they passed up B and D is the cost is such that it exceeds the benefits that you would get out of it. So if you're working for a big company and you continue to work, sign up for Part A, maybe opt out of B and D, and then later on come back and pick those up. So when can you enroll in Part B if you skipped it originally? Anytime you want, up until your coverage at work ends. And once your coverage at work ends, you have up to 8 months to enroll in Part B. You may want to look and do a little studying once you get into this if you're still working. What are you paying for group health insurance and what would it cost to get on Medicare? Now, a lot of times what we'll see is the working spouse that's got the family covered turned 65 a year and a half, 2-3 years before the non-working spouse. So they keep working until 67 or 68 until the non-working spouse becomes 65, and then they both go on Medicare. You do have an option or an alternative to that, and COBRA goes for 18 months, and a non-working covered spouse can go on COBRA by herself. So if you want to retire a little bit earlier, you don't have to keep working till 68. You can retire at 66 and a half. COBRA will carry your spouse up to age 65. So you can enroll at any time before your coverage ends, and then 8 months after. For Part D, the drug, you can do the same thing, enroll at any time, but you only have 63 days after your coverage ends to sign up for a drug plan without penalty. So the best time to enroll in Medicare to avoid late enrollment penalties is during the initial or the special enrollment period. And to avoid gaps in coverage, sign up before your current insurance expires. Now, maybe you just totally forgot it. You're 68, you're 69. Either you forgot it or you just said, I'm in such good health. I don't think I want to enroll right now. I'm going to save that money. And all of a sudden, it's July the 15th of 2020, and you've been retired for 3 or 4 years. You're like, man, I better get some of this. Well, you have to wait until January, February, or March to even initiate the enrollment. And once you sign up during this special enrollment period, your coverage does not begin until the following July the 1st. So somebody that wanted to get into it today that was over 65 could not be covered until July 1st. So that's the general enrollment period. So we have the initial enrollment period for everybody that's age 65 who's not currently working and covered by a big group. Best time to sign up is 3 months before you're 65. It starts the first day of the month. The special enrollment period is for working people over 65 who are covered as a worker or a spouse under a big group. And you sign up here before coverage ends, and it starts the first month of enrollment. And then the general enrollment period, again, you can only enroll March 1st through the 31st, and coverage begins July 1st. So how do you sign up? Well, I apologize for this screen. It's a mess, but you can go to www.ssa.gov, Social Security Administration.gov, or you can go to www.medicare.gov, or you can go to the last one on here, ssa.gov/benefits/Medicare. So those are the sites you go to. Look around, navigate them a little bit. There's a lot of answers there. So I'm gonna go to Medicare.gov homepage, and here we are. And you'll notice in the upper right-hand corner, my Medicare.gov login. Well, just like for Social Security, you have to set up an account. And if you haven't done that, please go ahead and do so. There are a lot of people getting Social Security numbers and setting up accounts, changing the address, and then applying for benefits for people. So even for your kids, go ahead and set up a Social Security login. And you set up a My Medicare Gov login. And they'll ask for some personal information, and it's okay. So when you look at this, this is the official U.S. government site for Medicare. Sign up or change plans. That's primarily for Medicare Advantage. What does it cost? You can see, you can click on this and go through it, and it'll tell you. What does it cover? The drug coverage, Part D, you can go in here when you're trying to figure out which one of these drug plans do I want. Put your medicines in, and they'll give you a list of all the companies that sell in our area that will cover you. And there are 800 numbers. You can call them, you can talk to them. You'll notice the next one is supplements and other insurance. So this is your Medigap policy. So you can do a lot of research here. You also can find insurance agents that specialize in selling Medicare supplements. And they usually sell the Advantage plans. They get commissions on the supplements. They get commissions on the Advantage plans. They do not get commissions on the drug plan if you buy that. But if they're worth their salt, they'll help you enroll in that. So again, Medicare.gov or ssa.gov/benefits/Medicare. So that's where you go, and you can find a lot of information there. If you want original Medicare, parts A, B, and D, you can sign up for just about all of it there. If you want a Medicare Advantage plan, you can go in there and get information about different ones. If you're going with original Medicare, you need to shop for a standalone prescription drug program. If you're enrolling in a Medicare Advantage plan, you want to make sure it's got drug coverage, and you need to shop that out and see the difference. And again, you can apply for the Part D either through the private insurer or through that website, Medicare.gov. Or you can call them, but right now with so many people working from home, Social Security and Medicare's wait time is about an hour and a half to 2 hours. So we have a thing called coordination of benefits. And why is it important to enroll in a timely manner? Well, if you're 65 and older, entitled to Medicare, and covered by a big group, one of those 20 or more, who pays first? The big group health plan pays first. Who pays second? Medicare. So they'll come in and pick up your copays and your deductibles. If you're working for a small group, fewer than 20 employees, who pays first? Medicare. So if you haven't signed up for Medicare and you're on a small group, the group health plan is not going to pay until Medicare pays. And if you don't have Medicare, there's no way they can pay. So you just don't want to be a member of a small group and have a claim and not be on Medicare. If you have retiree coverage, who pays first? Medicare pays first, and then your retiree coverage pays. We've got an advisor in the office whose father just retired and his own retiree coverage, and they're just flipping it. So rather than the retiree coverage being first and Medicare second, now Medicare's first and retiree coverage is second. And if you're on COBRA, Medicare pays first. And then COBRA will help with some of the deductibles and the copay. But COBRA is temporary, it's very expensive, and if you don't have Medicare, it won't pay anything. So keep that in mind. So we have private insurance here, and we have Medicare. So we've got public and we've got private. There are premiums, and when Medicare was established back in the early 60s, they made it look a lot like the major medical policies that people were buying at that time. So Part A, there's no cost for it. Part B, premiums are paid directly to Medicare. And if you're getting Social Security, they simply take that out of your check. If you're not on Social Security, you can make a quarterly payment for that. Private insurance is paid directly to the insurance companies. I think you can have your Part D taken out of Social Security if you want to. But Part D drug plans and Medigap policies are paid directly to the private companies. Medicare Advantage Plan, if that's a cost, those are paid directly to the insurance company that you selected. Your out-of-pocket costs include deductibles, portions of the doctor bills not paid by Medicare, and services not covered by Medicare. So what are the premiums? Well, I said Part A was free. It's not really free. Somebody's paying for it. And if you're still working, look at your pay stub, and it has a little thing on there, Medi. And that's 1.35% of your pay that you pay, and your employer matches that. That takes care of Part A. So all the working people in the United States are paying for Part A. And it's free if you have 10 years or 40 quarters in, you or your spouse. If you have less than that, you have to pay for Part A. Part B is a minimum $144.60 a month. In 2020, that price has been going up on an annual basis, $5, $6, $7 a month. In addition to that, there's a income-related adjustment, if applicable, and that's called IRMA. We'll talk about that. Part D, the drug part, is paid to a private insurer. The premium depends on how rich the plan is, what your deductible you select, how many drugs you're taking, and where you live. And it also has an income-related adjustment. So let's take a look at this monthly income-related adjustment. We call it IRMA. So this modified adjusted gross income, for 2020, it's based on your 2018 income. They always look back 2 years to see what your income was. And people say, why do they go back so far? Well, think about it. Today is July 14th. Taxes aren't due until tomorrow. So the government has no idea what kind of income a lot of people had in 2019. So they can't base it on last year. They have to base it on the year before. But that modified adjusted gross is the amount of your income before you itemize or before you take the standard deduction. Plus, they add to that any money that you put into a retirement plan that you didn't have to pay taxes on, plus any income from municipal bonds that you did not have to pay taxes on. So that's your modified adjusted gross. You'll notice we have single and joint and married filing separately. So if you're single and your income is $87,000 or less, or married and your income is $174,000 or less, your premium is $144.60 a month. And then for your Part D, so that's Part B cost. Part D cost is about $40. Right now, the average is a little under that, about $35, $36 a month. So if you're paying $144 for Part B and $40 for Part D, your monthly cost is $184.60, and that does not include your supplement. If you make $1 more, this income related monthly adjustment amount kicks in, and you pay an extra $57.80 for Part B. And now there's a Part D income related amount of $12.50. So your $184 jumped up $70 all of a sudden to $254. And the higher your income, the more you will pay for Medicare. So this married filing separately, sometimes there's a high earner and a low earner. And so what they're trying to do there is to maybe have one spouse pay a lower fee than the other. Because if it's joint, and let's just say this above $750, both you and your spouse pay the $608 a month for Parts B and the supplement. And it's not a supplement, it's just a surcharge to the Part D drug part. So there's some things you need to pay attention to. And one of the things that we like about Roth IRAs is that income does not count. But you need to be somewhat considerate when you're doing a Roth conversion, because if you do a big one, it can throw you into another bracket. So you might want to do those as fast as possible before you get into age 65. Okay, so you can, when I told you at Medicare.com, you can see what this costs. This chart is there. Now, if you are in one of these higher brackets down here and you're having to pay the IRMA, income related adjustment, but your income is going to go down once you retire, there is a form called SSA 44, and it's the Medicare Income Related Monthly Adjustment Amount Life-Changing Event. And there are about 8 events in there. But one of the events is work stoppage, which is a funny way to say retire. But if you stop working and you're going to have less income in the future, fill this form out, and they will go by this form to determine how much you've got to pay, rather than going back and looking 2 years at your tax return. And this form has saved a lot of people a lot of money. And you should have gotten this form, an email form. But if you need it, we can help you get it. So Medicare does have deductibles. Part A has a deductible for every illness, $1,408. Part B, the doctor has a deductible in diagnostic testing of $198. Remember that $198. We're going to talk about that in a minute. I have been in Medicare, original Medicare, for 8 years. Now, I've paid some money for drugs because I've got a crappy drug plan, but I picked the cheapest one I could find. But I've got a real good supplement plan. And other than premiums, I have not paid 1 penny out of pocket for doctors, for tests, for hospitals, for anything. Just drugs and just my premiums. So coinsurance, how much do you pay? Well, after 60 days, you pay $352 a day for every day you're in the hospital. And it ultimately gets up to $704 a day. For skilled nursing, after 20 days, you pay $176. For claims, you have to pay 20% of the doctor bill and the various tests that you have to have if they're assigned. If they're unassigned, you not only pay 20%, but you pay another 15% of the Medicare approved amount. So you would like to get to a point where you don't have to worry about getting treatment because of the cost. So drug plans are pretty standard, and if they have a $435 deductible, then you pay 25%. Once the bill hits about, the insurance companies have paid $4,000 or $5,000, then it's pretty much on you. You've got to start paying a good bit more. And once you've spent $6,000, then you're pretty much through paying. So people that are having $20,000 and $30,000 of drugs every year have to spend a good bit of money, even with a good drug plan. You might be able to get one that's really good but pretty expensive. So that's why you need to shop that. because these things vary very widely. The good news is that you can change your drug plan every year in open enrollment if you need to get more coverage or less coverage. And open enrollment is October 15th through December 8th. What does Medicare cover? 100% of the first 60 days after the deductible, 80% of doctor's visits, outpatient services. Some things it covers without a deductible are like flu shots and prostate screenings and some things like that. What does it not cover? Does not cover nursing homes and long-term care, assisted living. Does not cover care outside the United States. You can, if you're traveling on vacation, you might want to get a special policy just to cover you. It's not that expensive, a couple $100. If you do have a supplemental policy and there's an unexpected health event, normally they will cover you, the Medigap policy. Normally does not cover dental, vision, hearing aids, cosmetic surgery, acupuncture, alternative care. It doesn't cover amounts that are over the Medicare approved amount, and it doesn't cover your deductibles. So you're going to have to spend some money in retirement on some of this stuff. Now, when you look at what private insurance will pay, it pretty much picks up the gaps, picks up the Part A deductible. It picks up hospital cost after 60 days. It picks up the 20% that you would pay a doctor. And that could be substantial if you have some pretty serious surgery. Prescription drugs, it'll cover a good bit of that, but not all of it. Medigap policies are private health insurance for individuals sold by private insurance companies, and it supplements original Medicare Parts A and B. It does not supplement Part C, the Medicare Advantage. And they follow federal and state laws that protect you. And it used to be these companies all did things a little differently, and then they were standardized in the forms several years ago. And most of them are identified by letters. As I said, it does not work with Medicare Advantage. You pay a monthly premium, and costs vary by plan, company, and location. So what's the plan? Well, here are the Medigap plans. A, B, C, D, E, F, up to N. Now, if you were 65 at the beginning of the year, my understanding is you could still buy a plan F. If you are not 65 at the beginning of the year, the most comprehensive plan is the G plan. So I have F, and as I said, I have not had to come up with one penny for any medical expenses. If you look at the difference in F and G, they're pretty much the same until you get right here. And this is the Medicare Part B annual deductible of $198. The government wants you to have some skin in the game. So you've got to pay $198 for Part if you have Plan G. The good news is Plan G cost is, there's a savings there because it costs less than $198. The cost is less than the $198 is less than you save more than you pay. That's all. I apologize. So it's okay. You get a discount more than $198 for going with Plan G. But if you were 65 and you want to go with Plan F, you can still do that. Okay. Advantage plans. Medicare Part C Advantage plans are approved by Medicare. They're called Part C. They're run by private companies. Medicare pays $700 or $800, as I said, for each member's care. You may have to, and you usually do, have to use a network of doctors and hospitals that they've approved. They often include prescription drug coverage, and they may throw in things like vision or dental. They're trying very hard to attract more and more members because it's such a profitable thing for them. And your benefits and your cost sharing may be different, and there are 3 or 4 5-star Medicare Advantage plans. So if you're going to get a Medicare Advantage plan, seek out those 5-star plans. They're the better ones. We had some questions, and the question was, why would I go with A and B and D? I got to pay for D, and I got to pay for my supplemental insurance, my Medigap, when I can get a Medicare Advantage plan and I don't have to pay anything. Well, the reason is the network. And where we see a lot of Medicare Advantage plans is in big cities where there's just a lot of doctors and a lot of services. And the more rural you get, the less Medicare Advantage plans we see. The problem with them is at 65, no big deal. I just get my regular checkups or cold and flu or whatever. No big deal. But when you hit 75 and 80 and 85 and 90, and you want to get some specialized care. So if I get cancer, I want to go to MD Anderson. If I need heart valve replacement, I want to go to the Cleveland Clinic. If I need brain surgery, I want to go to Johns Hopkins. And Medicare Advantage may not allow you to do that. The other thing about Medicare Advantage plans is they're not written in stone. If the company starts losing money, they can reduce the benefits. There's not a whole lot you can do about it, except during the open enrollment period, go in and check all the other Medicare Advantage plans and see if you can switch. So if you're on Medicare Advantage, you need to go to that Medicare.gov every fall and just look and see if you've got the best plan that's going on. I've got a client that works at the hospital, one of the local hospitals, and he came in for a review. I guess he's had a pretty rough day because he said, man, when I turn 65, I'm going to get the original Medicare. I'm so tired of hearing these Medicare Advantage people complain about they need services and the company won't approve it. And then not too long ago, I was talking to a client. He said, I apologize for my mood. Said, I've been talking to my insurance company. Said, they're not paying my hospital bills like they should. So I've never heard anybody complain that was on the original Medicare, but I've heard people on Medicare Advantage plans complain. So shop carefully. Medigap policies are standardized, but premiums vary considerably. So look at all the different policies. There's Blue Cross Blue Shield, there's United Healthcare through AARP. There's companies that you never heard of. And there are agents out there that can give you a spreadsheet of what all the different policies cost. So you want to get a good policy and you want to get it at a good price, as good as you can get. Same way with drug plans. Shop those out because there's a difference. And Medicare Advantage plans differ quite dramatically as well. We were at Mee Island for 2 weeks in June. And a lot of retired people in Florida. Man, it was amazing how many Medicare Advantage plans we saw advertised on TV. So a final word on healthcare is costs are going to be higher, insurance premiums are going to be higher, your out-of-pocket costs may be higher, prescription drugs are going to be expensive. You're going to have to pay for dental and vision and hearing and some of these other things, long-term care. So it's when we build a retirement plan, we like to put these things in and account for them with an increase in cost. So if you were to retire today, this is just a snapshot of about what original Medicare would cost. Part B premium of $144.60, Medigap policy somewhere between $150 and $200, Part D somewhere between, let's say, $17 and $60. We'll settle on $40. About $385 a month is what it would cost you. So Fidelity did a study of how much does it cost a couple, excluding long-term care, for healthcare costs, premiums, copays, drugs, things that aren't covered. And they came up with a number of $285,000 for couples. Now that's a 30-year number. The Employee Benefit Research Institute broke it down by sex. They said it's $144,000 for men, $163,000 for women, together $300,000. So you may be a lot healthier than other people. You may be a lot sicker than other people. But the healthier you are, obviously, the less cost you're going to have to spend doing this. So long-term care is not covered by Medicare or by Medigap. If you have a 3-day hospitalization before you go into a nursing home, it will cover it for 20 days. But then the deductible for after 20 days is $176 a day, which is about what it costs anyway. But then after 100 days, they won't pay anything. And if all you have is you just need help with your activities of daily living, none of these policies will pay anything for that. So that's another subject we can talk about later if you'd like. So 3 reminders. When we want you to enroll in time when you turn 65, preferably 3 months before you do. Here's an example of somebody that waited 12 months and enrolled. So they got to pay not only the $144.60, but a 10% penalty of $14.46 a month. So rather than $144, they're paying $159. Now next year, if the price goes to $150, their penalty is $15, not $14. So that penalty is there for life, and it can be expensive. How do you enroll? You shop carefully for private insurance to go with Medicare, and you enroll at Medicare.com, Medicare.gov, or else at the SSA.gov/benefits/Medicare. And what does it cost? Depends on which plans you sign up for and what your income was in 2018. You can use that SSA 44 form to lower your cost. Please do so. So thank you. I appreciate your attendance. Here's that last website I mentioned, SSA.gov benefits.Medicare. Questions. Betsy, do we have any questions?
Yes, we've had a few come in. We had one that says, I'm a dependent on my wife's insurance, which is part of her TRS retirement. She made 65 on February 4th of this year. I'll make 65 on June 7th of 2021. When should I enroll and which parts? And also, I'm still working and will be working through December 31st of 2021.
Okay. A lot of moving parts to that. Your wife's retiree insurance will cover you until you are 65. So I don't remember your birth month, but I think it was June of 2021. So June 1st is when you need to have your Medicare benefits start. What most people do that are under TRS, which is Teacher Retirement System, and they have the state of Georgia health insurance, is they continue to keep their state policy, and that becomes their supplemental insurance, their Medigap policy. And that policy also has credible drug insurance, so you don't have to buy Part D. So I would suggest that in March of 2021, you go on and you sign up for Medicare Part B. Okay. All right.
All right. Also, if you select Medicare Part C as your choice, can you go back to A, B, or Medigap in the following years, or vice versa?
I don't know who asked that question, but thank you.
Pardon me?
I said, I don't know who asked the question, but thank you.
Yeah.
Here's the deal. The Medigap policy is guaranteed at age 65 without any underwriting, without any questions, without any exclusions. And for up to 3 months after you're 65, you can get it. Now, when you're 75, and you can always go from an Advantage plan back to original Medicare. What you can't always do is qualify. I'm going to stop this. I'm going to leave it there. What you can't always do is qualify for these Medigap policies, because if you've had some medical history, they can deny you coverage. However, if you're in your first year with a Medicare Advantage plan, my understanding is anytime during that year or at the end of the first year, you can go back. And if you had a Medigap policy before, they have to take you back, even if something has happened. So the biggest concern I have about Medicare Advantage plans is what will they look like when I really have big hospital bills or big doctor bills, and nobody knows. The reason people like them is because there's no premium and they're free. Sometimes you get what you pay for. Okay.
Okay, another question. If I turn 65 6 months before my wife turned 65, do we register at the same time?
Not exactly. So you will register 3 months before you turn 65, and she will register 3 months before she turns 65. And if you're already, well, if you're already receiving Social Security, you don't have to do anything other than pick out a Medigap policy and a Part D drug plan. And I would start doing that 3 months beforehand, those two things. If you're not receiving Social Security, then you need to go in and sign up 3 months ahead of time for Parts A and for Part B. But if you're already getting your Social Security, then it becomes automatic for A and B, and you just need to be proactive on D and a Medigap policy. So there's a little 6 month window in there. So if you've got COBRA or something, she can stay on the COBRA by herself without you, as long as the COBRA's time frame does not run out.
Okay, the last question, and you touched on this a little bit, but just to give a thorough answer, given the options between an Advantage plan and a supplemental plan, are there key elements to help identify which is the best option? The Advantage plan has a $0 premium and covers more than a supplemental plan. So why would you select a supplemental plan if your physicians are in the PPO? Am I missing something?
No, this is just it's a matter of personal choice. And it's you know, and if given a choice, I'd rather pay zero than something. But I think given the cost of health care on down the road, I just think original Medicare is better. And if the Medicare Advantage plan was frozen in stone, I'd say, yeah, go with it. But because they can change what they pay and which doctors they use and what benefits they want to offer on an annual basis, it's good for now, and it's good as long as you're healthy. And most 65-year-olds are pretty healthy. So as I told somebody, look at your parents and sort of see what their end of life looked like. How much of it was what was a medical expense? 80% of all Medicare money is spent on the last 2 years of most person's life, because that's when we're the sickest.
All right, and then people are curious if we'll be sharing this information with them via slides or the recording.
We are going to do our best to get this recording to you. Come on, computer. Some of the information that we have already sent you, this is that last website we looked at, ssa.gov/benefits/Medicare. It's just got a lot of information. mymedicare.gov. Make sure you create an account there. Here's the 800 number if you do want to call them. Should I sign up for Part B? I will say this. If you've got a Medicare Advantage plan, you better not be doing a lot of traveling because it only covers you in your local area. Now, they will make exceptions if you're out of your area, but we had a client that retired, went out and bought an RV, and once football season was over, they took off and went to California and all around the country and didn't come back until midsummer. So they were out of town 6-7 months of the year. So if you've got, vacation home you spend a lot of time at, I don't think a Medicare Advantage is a good way to go. I think you're definitely better off because you may not be in the network. And if you go to doctors not in the network, they bite you pretty hard. So this is that website. It's a good place to go look around. This is the SSA 44 form, and it's got all the different income things, and you fill it out. Here are the life-changing events, and work stoppage is the one we want. There's some other reasons on there that you can use, but normally work stoppage is the one most people use. We sent you a Medicare enrollment chart. It's pretty good. Will you keep working after age 65? Yes. You work for a big employer? Yes or no? The answer is yes. Is it a good plan? The cost of benefits compare favorably to Medicare? If it's yes, no need to enroll, but call them to confirm. And if you're enrolling in an HSA, do not enroll. Okay. If you don't think it's a very good plan or it's not a good plan, then you must enroll in Medicare. If you're not going to work, you must enroll. If you have retiree insurance, that normally becomes your Medigap. If you don't have retiree insurance, shop for Medigap and shop for a drug plan or Medicare Advantage. So this is pretty good. And then there's some things here if you work for a big company to keep an eye out for. And then just some general considerations. Can you see the doctor you want? Are the right specialists available? How much will you have to pay for medications? What's the monthly premiums? What are the out-of-pocket costs you might expect to pay? Are family benefits important to you if you need spouse coverage? So there's just some things here. So these have all been sent to you. We do have one other piece that we're going to try to send out, and this is called Key Financial Data. And it's got all kind of tax rates and different things on it. This shows the IRMA and how much you pay for Medicare as your income goes up. This shows how much you got to take out of your retirement account. And this is out of date because there was a new law just passed. So anyway, all right. So Betsy, you checked all the conversations that came in?
Those are all the questions.
Okay, well, great. Well, it's 7 o'clock. We took a little over 45 minutes. The people here are not, we don't spend all our time doing Medicare, but we're well versed in it. And all the advisors here are pretty good. If your advisor you have questions, you can call me or you can call your advisor, and we will gladly assist you in any way that we can. We thank you for placing your trust and your faith and your confidence in Vickery Financial Services. That's not something we take lightly. And I look forward to seeing everybody in the near future, either personally or virtually. So thanks for tuning in. Good luck. Stay safe. And we'll see you soon.